When you engage your patients in communication, they will do 90% of the work in coming to a diagnosis that you otherwise are without if you don't have that patient perspective. I would propose to future physicians that actually one of the key medical terms in their profession, diagnosis, was rooted in the social aspects of civilization. I hope that our conversation will inspire others to believe in the ability and the benefits of remaining hopeful.
Today, we're joined by Dr. Paul Abney, whose journey offers a rare perspective as both a clinical psychologist and a patient. Welcome to the CARTI Hopecast, where we explore stories that shape us, journeys of resilience, hope, and perseverance. We seek the lessons that emerge when we face the unexpected and find strength in the struggle. I'm Adam Head, and today I have the opportunity to sit down with Dr. Paul Abney, a psychologist and educator. Paul has spent decades teaching future physicians about empathy, communication, and the power of the doctor-patient relationship. Then, unexpectedly, he found himself a patient. Paul, welcome to the CARTI Hopecast. Welcome.
Well, thank you very much, Adam. I'm thrilled to be here, honestly.
Well, looking forward to this conversation. Before we talk about illness, medicine, or psychology, I want to start with you and your story. For listeners who don't know you yet, how would you describe your life and work before your own healthcare journey ever entered the picture?
Sure. Well, just chronologically speaking, I was born in the South in Shreveport, Louisiana, and I graduated high school in 1969. And as you know, it was a time of social upheaval in our country and beyond. And I enrolled in the university, and over the 8 years that it took me to graduate, I worked in different areas, and ultimately finished with a bachelor's in philosophy, and went into industry at that point and spent 20 years in industry, actually in apparel industry. And there was an upheaval in that industry as well, with a lot of consolidation. And I, at 40, decided I would pursue an interest that I had always had and returned to the university. And 5 years later, I obtained a doctoral degree, and my doctoral degree is actually in counselor education. And I never lost my love for academia, so I established a private practice and worked primarily with individuals with substance dependence and other comorbidities or mental health, and returned to academia and spent the next 20 years, as you pointed out, in a medical school working with future physicians. I served as a professor in psychiatry and behavioral sciences.
So, Paul, what originally drew you to the field of psychology and ultimately becoming an expert and teacher about human connection in a healthcare setting?
Adam, I think it was the times in which I was born. I think that there was a lot of social change that occurred in the United States during the period of the 60s and the 70s, and I was swept up in a lot of that change, being 20 years old, 19, 20 years old, and then entering into industry for the next 20 years. I encountered a lot of the struggles that people experience in life and in everyday activities and the stresses that go along with that. And it tweaked my interest. I had originally planned to go into a master's program, that was entitled The History of Consciousness. And I got sidetracked and ended up in industry and never lost the thought that I was interested in the field of psychology and counseling. And when I had the opportunity, I decided it was something that I was going to pursue, and I've never looked back, never regretted having changed courses.
And ultimately landed with this focus specifically in healthcare and working with future physicians. And so now you've spent years teaching future physicians about communication and the doctor-patient relationship. And I'm just trying to imagine you standing before a room of very smart individuals, all working to become experts in their chosen field of medicine. How would you typically draw in those that you're teaching to a world beyond diagnosis, beyond treatment, beyond the clinical core of what they've already been taught into something even deeper?
So much of what you said is very accurate with how my experience was. They were very talented and learned individuals pursuing medicine, I felt quite intimidated by their dedication and devotion. Yet you ask how I drew them in, and you mentioned diagnosis. One of the things that I like to pull out of my hat in one of my introductory lessons was that word diagnosis. And when you look at that word, that prefix dia means between, like diameter or across. And then gnosis was a Byzantine order in the 1st century AD that were known as the Gnostics. And the reason why they were the Gnostics were they knew the word, the truth. So when I would propose to future physicians that actually one of the key medical terms in their profession, diagnosis, was rooted in the social aspects of civilization, it tweaked their interest. Yeah. That all of a sudden, oh, well, there is a social element beyond the hard sciences, the biological sciences. So say some more, Dr. Abney. And so I would follow up with the idea that dialogue ties right in with diagnosis. That dialogue, again, meaning between or across, and log being logos, or the word. And so the word was what the Gnostics knew. So you have this parallel between diagnosis and dialogue, and how important having that communication between doctor and patient actually is in the hard science practice of modern day medicine. And, you know, Adam, that was really brought forward by Kubler-Ross, who came up with the 5 stages of grief, and how before physicians were less involved in the emotional aspect of health and wellness and more committed to the physical. And it was her efforts that really redirected physicians to consider, well, there's another element here that is involved in treatment. So that's how I usually would get them engaged. Yes.
I would imagine it was very effective. So after now many years of study, what is most often misunderstood, in your opinion, or missed across the healthcare spectrum in a provider or physician-patient relationship?
Yes. I believe, Adam, that the way that our healthcare system operates presently, there is a lot of pressure on physicians to keep on schedule. Yeah. It's just the economics of the profession, and it challenges a physician to have the time to engage patients in a dialogue, leading and enriching their diagnosis. And I would frequently tell the students that if you're in the process of creating a diagnosis, you want to learn of the patient. And if you look at that word learn, 80% of that word is earn. And if you look at earn, 75% of the word earn is ear. So you listen to learn. And that when you engage your patients in communication, they will do 90% of the work in coming to a diagnosis that you otherwise are without if you don't have that patient perspective to enhance the training and the knowledge, the medical knowledge that you bring to the relationship as a physician. So, I really just always wanted to emphasize that and the importance of doctor-patient rapport and patient or physicians being comfortable entertaining that communication with their patients. I don't want to get off into my lectures of communication yet.
No, it's good.
It's near to my heart.
No, it's fascinating. Yeah. I'd like to shift now, if we can, to your own healthcare journey.
Sure.
Can you take us back to the moment when it hit you, oh my gosh, now I'm going to be a patient myself? And how did you begin to emotionally process the weight of your newfound diagnosis?
I don't recall it so much as being a moment. It was more a series of events, Adam, that I encountered that led to the realization that I was ill. I believe around the in third quarter of 2022, I first went for an eye examination and was told, did anyone ever mention glaucoma to you? And no, no. And the physician went on to say, well, you actually have very advanced open-angle glaucoma, which is a devastating diagnosis. It's incurable. They can impede the progression, yet the damage is done, so to speak. And shortly thereafter, I learned that I had congestive heart disease and needed a valve replacement. And to top it all off, I received the diagnosis of prostate cancer about the same time. So even though, honestly, Adam, I didn't feel any of the illnesses per se, it was quickly apparent that my abilities to continue in my career were coming to an end. So I think that's when it began to settle in with some gravity that my life was changing.
Well, even one of those would be incredibly difficult, but that's a lot in a short period of time.
It was.
Yeah. So now, Paul, you're the one who is fully experiencing what you've taught physicians for years up to this point, or up to that point. How did it feel to engage yourself in the same type of human connection experience you'd been studying so much of your life?
Excuse me. I initially was observed and evaluated at several of the leading medical institutions in the country, particularly regarding the prostate cancer. And you're right, Adam. As a patient, I had a different perspective of what that experience was to be like. And throughout that experience, I had a chance to witness, is this how it is that I imagined as a educator that the physician was likely to perform, and as a patient, was the physician's performance as impactful upon me as a patient as I believed it to be and as I had taught?
Sure.
And I came to know that it is. It is very much so. Though I don't want to tout a single institution, I quickly became sensitive to the differences between institutions, which led me to decide ultimately where I was going to undergo treatment for my prostate cancer. I think you might be aware that today I finished 40 radiation sessions. So
congratulations.
Yeah, thank you very much. It's quite something.
Yeah.
You know, the institution allows me to ring a bell, and I was surrounded by staff. It's a joyous moment. Yes.
Brene Brown says sympathy is feeling for you, while empathy is feeling with you. Having now been the patient in the exam room, having questions, facing uncertainty, has your definition of empathy in a healthcare setting changed? And if so, how?
I so appreciate that definition, that narrative surrounding empathy. Of course, it was a subject or topic that I touched on frequently in my teaching. My view, very similar, that sympathy is about the patient and feelings for the patient, which I think is really difficult for physicians in the sense, especially in specialized fields like oncology, where they encounter a lot of patient suffering and loss. Very hard to maintain that emotional boundary for a physician to be able to go in and day out and provide treatment
for sure.
Empathy is so important in the doctor-patient relationship, and I would encourage my students to view empathy really as one of the strongest diagnostic tools available to them, in as much as that empathy being about walking in the patient's shoes, and I would encourage them to consider using some of the stems in their communications, such as, well, I imagine this diagnosis might be scary for you. I imagine you might be struggling with what's going to come next. I imagine, you're worried about the impact this is going to have on your family. And then listening. And once they provide the patient with that platform, with that space, and indicate an interest and a concern for the patient's experience, the patient will often guide the physician right to where their pain is, right to where that empathy is really a salve for the patient who has an open wound at the moment, both emotionally, specifically emotionally. So empathy, while it is so beneficial for the patient in establishing the rapport, it's really helpful in a sense for the physician also in filling in their diagnosis by letting the patient guide them to where their social, psychological, and emotional needs are, as well as their physical condition.
There diagnoses and, in a broader sense, life events that can disrupt a person's sense of control to the point of challenging their very identity. In what ways did this experience change how you understood your own vulnerability, resilience, perhaps how you saw yourself in general?
I imagine it's true for a lot of our listeners that once having, received a diagnosis that in some cases, to some extent, many cases, in every circumstance is a terminal diagnosis, it's life-changing.
Mm.
It's the realization that I'm not immortal.
Mm-hmm.
We as human beings, we spend a great deal of our time pushing off the perspective of our lives ending, certainly the fear of them ending as a result of disease.
Mm-hmm.
So it matters greatly how that diagnosis is given and the amount of support that the patient experiences in receiving that diagnosis. It changes the world.
So Paul,
their world.
Yes,
I want to add, and certainly for the physician to also be in the position to bring forward news that they themselves know are devastating and concerning for the patient, and wanting to be there in a therapeutic role at the same time too. Very challenging for the docs.
So Paul, navigating your own treatment and recovery, and now having perhaps a fuller, though unwanted, personal understanding of what you've taught for so many years. If you were to walk back into a room full of future healthcare professionals, knowing what you know now, what would you say to them?
Adam, when I was graciously invited to participate in this podcast and knowing that it's the Hopecast, I thought about, I went back to President Obama's exhortation for one to keep hope alive. Mm-hmm. And I think I would let my students know that I came to believe that how that really is read by me is that hope keeps one alive. Mm. Not so much one keeping hope alive as that at the point of a diagnosis that likely is a terminal diagnosis, it is in fact one's hope that keeps them alive at that point. So in the role of a physician, and certainly in the experience of a patient, to be able to maintain that hope that there's always support. There well may be circumstances, situations that are in fact incurable, yet there's always that realization that I will experience how it is that I feel as I advance toward what is in the future for me based on the condition that I am experiencing right now. And there's plenty of encouragement around for people to have a positive attitude. There is, in my treatment experience that I'm in the midst of right now and have been undergoing for the last 3 months, it is overwhelming the amount of support that has been displayed and shared among fellow patients like myself, much less how helpful the staff has proven to be, how encouraging and optimistic the physicians have been above and beyond the actual treatment that they have provided. It's also the acknowledgement and the appreciation of the emotional toll that a disease has upon a person that can be impacted by and through hope and support from others.
Well, Dr. Paul Abney, thank you for sharing your story and your own journey. Before we close, is there anything else that you'd like to share?
Well, I'd like to share my appreciation for you hosting me, Adam. I hope that our conversation will inspire others to believe in the ability and the benefits of remaining hopeful as they walk through their journeys of dealing with how life has become for them, that they will decide the end of for themselves and oftentimes the recovery from. So yeah, I think my closing remark is to keep hope alive, and that hope will keep one alive, and to stay at that.
Thanks for joining us on the CARTI Hopecast.
Thanks for having me, Adam.